Yes, thank you for joining us this morning. My name's Heather Sandover. I'm the grants manager at St Martin in the Field charity, and I'm here to facilitate our mental health and homelessness session this morning. So we've got a range of speakers with us today. We've got Jake Lake, Tess Saunders, sorry, the heat's getting to me, Sarah Phillips, Chloe Jo Morgan, Nicole Cook, and myself. Becky, if you could just whiz on to the next slide, please. Thank you, Becky. So the purpose of today's session, so we're going to be providing a bit of context and overview of our Mental Health and Homelessness Fund and what we've been doing over the past couple of years. We're then going to learn about a range of mental health interventions in 3 different housing settings. So each of our speakers today, they're coming from a different charity and a different project across the UK, and they're going to be providing an overview of what they've been doing over the last couple of years through the support of St Martin in the Fields grant funding. And we're then going to reflect on some of the learnings that can be shared across the sector. So some of the key insights from the mental health and homelessness projects across the couple of years. We have got, just in terms of general housekeeping, there is a chat function. So feel free to introduce yourselves. I'll keep a monitor of that. If you've got any questions, I will ask that we do those at the end of the presentations, just to kind of prevent any sort of stop-start with the flow. But please do put any questions you've got for our speakers today, and perhaps just put the name of the speaker in terms of who that question is aimed at, so we can just keep an eye on that. Next slide, please, Becky. So just a brief overview of the Mental Health Fund. So we set this up in 2024, and the aim was to provide funding to support the embedding of mental health support in 3 homelessness services across the UK. So this was our first kind of test in this area of work as an organisation. And the programme was developed in response to the voices of frontline workers via our Frontline Worker Survey, and we were repeatedly hearing that there was a need to improve access to mental health support for people experiencing homelessness. So back in 2022, when we were scoping out and designing this new grant programme, 75% of frontline worker staff described accessing mental health support for the people they were working with as difficult or very difficult. And actually, this trend has continued, although it's dropped a little bit. But in 2025, in our Frontline Worker Survey, 69% of frontline workers reported challenges in accessing mental health support for clients, with the same number also reporting that it was difficult or very difficult to access support for people with combined diagnosis. So it's an issue and challenge we were very aware of, that we know that people are seeing across the UK in a variety of different projects and housing settings. And back in 2022, we wanted to look at what we could do with our funding to test out and develop some solutions in this area. Next slide, please, Becky. So we provided funding to 3 programme partners, which are all here today, and we're going to hear a bit more in a minute. And the fund provided multi-year grants over a 3-year period. And these are projects that were working with people who are struggling with their mental health and at a critical point in their housing journey. So we were looking at that kind of transitional housing step. And the aim was to deliver support in non-healthcare settings. So again, this was looking at the impact of looking at these mental health interventions in housing or homelessness settings. The projects were all locally designed based on their local needs, but quite nuanced in their approach, but each seeked to improve housing and wellbeing outcomes. So you'll hear in a minute how there's some kind of differences with the projects, but they had an underlying theme which was kind of core to the program's core to the aim of the programme. So today we're going to hear from our 3 mental health and homelessness partners. We've got Jake and Tess from MAC-UK, we've got Chloe Jo and Nicole from Platform, and we've got Sarah Phillips from Rowan Alba. Next slide, please, Becky. Great, so I'm going to hand over to Sarah Phillips now from Rowan Alba.
Hi, thanks, Heather. So I'm Sarah Phillips. I'm a counselling psychologist employed by NHS Lothian, but I'm working into the Rowan Alba project. Next slide, please, Becky. So Rowan Alba provides a range of services. It's long-term supported accommodation and community outreach to those affected by homelessness, addiction, and social isolation. It has 4 temporary accommodation services and 3 long-term supported accommodation, as well as a community outreach team. Next slide. Thank you. The original plan aims were to embed NHS psychology into 2 of the services. So in terms of psychology input, I'm 2.5 days a week, and I have an assistant psychologist who is also 2.5 days a week. We are working into 2 of the projects, 2 of the services that Rowan Alba has. One is temporary accommodation for homeless women, and the other one is supported living accommodation for men with substance misuse. And the men in this service have previously been deemed unhousable in that their tenancies are frequently ended due to difficulties with neighbours. And this service was designed to move people off the street. So the aim of the project was to help develop psychologically informed environments within the services, fill a gap in provision by enabling residents to access psychological care within the hostel to begin to address their mental health issues, improve the physical health of the service users by linking with wider health system and supported service users access, which is when having an NHS psychologist has been incredibly helpful, as I can access health records and link in with other health systems more easily than if I hadn't been employed by the NHS. One of the other aims has been to increase the engagement of the service users with wider community support and activities to improve mental health and to prevent repeat homelessness by improving the mental health of service users, whilst also increasing their trust of services to engage with both health and community support. We've also aimed to reduce demands on other services by improving mental health and increasing trust with services so that residents are more accepting of support, leading to less time involved with unplanned and emergency service. We've also been evaluating the project. So next slide, please, Becky. So the overview of the plan, we had 2 areas of focus: the developing the psychologically informed environment. So this was indirect work, so working with the staff in the services. We carried out trauma-informed lens events with both services. So that's looking at how trauma-informed the service is, not just in the practices with the residents, but also looking at the physical environment of the services. In those events, we developed implementation plans. So we were looking at what was going well and what wasn't going so well, and planning to move areas that were kind of highlighted as red and as in need to having a plan to how we could move forward so that that area was more trauma informed. We also carried out a training needs analysis and developed training on 5 areas: understanding and working with mental health, understanding and working with neurodiversity, understanding and working with trauma, alcohol-related brain damage, and psychological first aid and staff wellbeing. We've also offered the staff monthly reflective practice sessions. So each team has had a monthly slot where we have met with them and have done reflective practice with them. We've used the protocol to monitor staff wellbeing throughout the project. So we've gathered lots of data around the activities that we've been engaging in. The direct work with the service users has involved psychological assessments, developing formulations, feeding into the support plans that the teams have, and then delivering either direct one-to-one interventions or small group interventions with the service users, or indirect interventions via the staff. And we've also been liaising with other health services and being able to make onward referrals for service users that are maybe able to access more mainstream services. Next slide, thank you. So some of the obstacles. When we started, NHS information governance and IT security, that's posed lots of problems for us. So just being able to communicate with the staff teams when we're not in, emailing each other has been difficult, but we've got around it. We found a way. There were health and safety issues. The trauma-informed lens event in one of the services identified that staff there weren't safe. So it was difficult for psychology to be working there, as we're employed by NHS, and the NHS had risk assessments which were identifying that there were risks posed. So we had to iron out some of those issues. The perception of psychology was a bit of an issue in that everybody was delighted to have psychology, but they weren't sure what they were going to do with us. And I think that went from kind of the high level down to the support workers, with the support workers being very suspicious of us and managers not being clear about what psychology could be doing and not aware of the breadth of activities that we could be offering. We also had the obstacle of Rowan Alba restructuring during the project. Rowan Alba increased from an initial 3 services in the first year to 7 services in the second year, which led to a restructuring of the organisation, which, you know, any restructure causes anxiety for its staff. So we were dealing with staff who were working in very uncertain situations. They weren't certain about their jobs, they weren't certain about job shifts, they weren't certain about where they would be working and whether they'd be moved to another service. So there was a lot of uncertainty, and delivering training in that period and reflective practice posed a couple of issues. But you know, it was, with any restructuring, you know, there will be an end, and that once we'd got through that, we could get back on track with our plan. So next, thank you. So where we're at now, we've completed the trauma-informed lens events. We're now focusing on a self-assessment of the services, but of Rowan Alba as a whole in terms of trauma-informed practice. Again, identifying gaps and targeting those gaps. We've delivered training, but it was paused. So we're now back on track with the training plan, and have a lot of new staff that we need to be delivering the training to. The reflective practice continues. One service we had to pause the reflective practice due to not just the reorganisation, but a number of staffing issues related to maternity leave and just natural attrition of staff. So reflective practice was put on hold in that service, but we're back up and running with that. The ProQual results showed positive outcomes in the first year for staff. And again, that kind of plateaued in the second year, but was expected with the restructuring of Rowan Alba. And again, we're hoping to see that the ProQual shows positive changes for staff. We've seen 21 service users for a psychological assessment. That's included 2 neurodiversity assessments, so 1 ADOS autism assessment and 1 ADHD assessment, as well as a couple of cognitive assessments. And we've had 21 service users who have engaged in psychological treatment. And we've also been linking in with other NHS services, so working closely with the mental health assessment service that we've got up here, and a number of the community mental health teams, as well as the drug and alcohol services. So our 2.5 days a week are very busy. Our key learnings, I think the planning of the project needed to be joined up at the beginning. You know, Rowan Alba thought psychology was a good idea. The NHS thought it was a good idea, but they hadn't thought about what actually would take place when a psychologist came into post. There had been some ideas, so the first couple of months really was thinking a bit about what was needed in the two services and talking to managers within Rowan Alba about what we could be offering. We needed management support right from the beginning. And again, I think at that point, one of the senior managers hadn't knew psychology was good, but again, wasn't sure about what we could be offering that would be helpful. And I think people had initially thought with the plan that the work would be focusing on the service users. And I think what we have all learnt through the past 2 years is the benefit for staff in terms of being able to deliver the training, offer the reflective practice, complete the trauma-informed lens event, which led to kind of safer environments for the staff and the residents. So I think there have been outcomes that people hadn't initially expected. Okay, that's me.
Thank you, Sarah. And if anybody has any questions for Sarah about anything, any aspect of the Rowan Alba project, please do pop them in the Q&A and we can pick them up at the end of the presentations. Okay, moving on now, we've got Chloe Jo and Nicole Cook from Platform.
Hi everyone, I'm Chloe Jo Morgan. I'm lead service manager at Platform and I manage some of our crisis prevention and housing services across Cardiff and Gwent. And I'm joined by my colleague who will hand over to introduce herself.
Hi, I'm Nicole. I'm senior caseworker at Platform in one of our crisis houses, working directly beneath Chloe Jo.
So today we're here to talk about our asset coaching provision, which is based within Tcanol, which is our crisis house in Gwent, and how this has strengthened continuity of support beyond crisis. So if we could move on to the next slide, please, Becky. So firstly, a bit of background on who we are. So Platform is a mental health and social change charity working across Wales and supporting over 17,000 people each year. Our work spans crisis prevention, housing, wellbeing and community support across over 170 projects, which includes adults and children and young people. And our approach is relational and trauma-informed, recognising that mental health is deeply influenced by relationships, lived experiences, wider social factors such as housing, financial stability, community connection, and opportunities for belonging and inclusion. So moving on to the asset coaching, and I'll hand you over to Nicole. If we can move to the next slide, please.
Okay. So moving on to the asset coaching provision. To give some context, Tcanol is a crisis house providing a short-term therapeutic alternative to hospital admission for adults living in Gwent who are experiencing mental health crisis. It provides a safe, relational environment focused on stabilisation and recovery. Referrals come through the crisis teams and 111 Press 2 service across Gwent, and individuals staying at Tcanol remain under the care of the crisis teams during this day. What we identified, however, was a gap following discharge from the crisis house. That transition from an intensive relational setting back into the community can be a particularly critical period, especially when combined with discharge from other services such as the crisis teams. That's often where people are at risk of disengaging or returning to crisis. And that's something we were seeing consistently in practice, not just once or twice, but as a recurring pattern. To address this, we embedded a dedicated asset coach within Tcanol. So what is it? The role begins by developing a working relationship during a person's stay and then continues that support post-discharge in the community. This means people don't have to retell their story after leaving T-Connell, and they don't have to develop trust and new working relationships with other support staff member. Once someone has left the crisis house, the asset coach will continue to meet with them regularly. This might be weekly, fortnightly, or adapted depending on their needs and preferences. Those meetings can take place in a range of settings, either out in the community or in someone's own home, depending on what feels safest and most appropriate for them. Support is very practical and tailored to the individual. For some people, that might involve support around housing, finances, or navigating services. For others, it might focus more on reconnecting with community, things like attending community groups, going to the gym, or building the confidence to use public transport, travel independently, or access new environments. The asset coach works collaboratively with individuals to identify and build on their strengths, setting person-led goals that reflect what matters to them, walking alongside the individual on that journey, doing with them, not for them. Importantly, there is no automatic closure if someone disengages. The relationship remains open, enabling people to re-engage when they're ready. This is quite different from more traditional approaches, where support is often closed after a set number of missed appointments or a period of no contact. What we recognise is that during periods of crisis or when things become particularly challenging, disengagement can be part of that process. So rather than withdrawing support at the point someone may need it most, the model is about meeting people where they are and keeping that relationship open. So support is there and when they're able to re-engage. So why it matters. People leave a very relational, supportive environment and then move into systems and communities where support can be much more fragmented. At that point, there's often a loss of trusted relationships and an increased risk of disengagement or returning to crisis. And I think this is something many services will recognise, that gap between structured support and what exists in the community. At its core, the asset coach role bridges the gap between crisis support and longer-term stability by maintaining continuity at a critical point in recovery. The journey here shows that flow from crisis into T-Connell, into asset coaching, and then on to community stability. What asset coaching is really trying to do is maintain engagement at that critical point in recovery when people are transitioning back into everyday life. Traditionally, support would stop at discharge. What asset coaching does is extend that support into the community so people aren't navigating that transition alone. And that's often where we see the difference. When someone has consistent support during the transition, they're far less likely to reach crisis again. So the focus isn't just on managing the crisis, but on supporting what happens next.
Lovely. So moving on to how it works, if we could have the next slide, please. So there are 4 key elements underpinning this model. So firstly, it's person-led. Support is co-produced with the individual, identifying their own goals and their priorities. The focus is on strengths and assets, what people already bring, rather than a deficit-based approach. So rather than asking them what's wrong, we're asking what matters to you and what's already working. Secondly, the approach is holistic. So the asset coach supports people across a range of areas, including mental and physical health, community connection, education and employment, financial stability, and housing. So this reflects what we see in practice, that people's needs don't sit in one area and challenges tend to be interconnected. So for example, someone might be experiencing financial stress, which impacts their housing stability, which then impacts their mental health. So what we're often working with people facing multiple pressures at once: housing, income, well-being. So support needs to reflect that complexity rather than addressing things in isolation. And if we only address one of those areas, it's unlikely to lead to sustained change. Thirdly, it's flexible and relational. So the work is built on trusted relationships that begin in T-Connell and continue beyond discharge. Engagement is flexible, recognising that people's capacity can fluctuate, particularly during or after crisis. We know that engagement isn't linear. People might move in and out of support, and that's a normal part of the recovery that we recognise. As mentioned previously, there's no automatic discharge if someone disengages. The support remains open, allowing people to re-engage when they're ready, which is really different from more traditional service models, where people might otherwise be discharged quickly and then need to start again elsewhere, often at the point when their needs have escalated again. Finally is partnership work again. So the role sits across internal and external pathways, supporting multi-agency coordination. That includes working with housing, health, community services, as well as accessing platforms' broader offer of employment services, supported housing and floating support. So this helps to create a more coordinated and joined up response, particularly for people with more complex or overlapping needs, because often no single service can meet all of those needs in isolation. When we bring all of those elements together, so person-led, holistic, relational support, and supported through strong partnership working, what this creates is a model that bridges the gap between crisis and recovery, providing a vital safety net for people who might otherwise fall through the gaps. And that's the key difference, is about where the support sits in that journey, not just what the support is. So moving on to the next slide, if we could, please. So moving on to the impact and key learnings. So the Asset Coach was implemented in March 2024. So we're just over 2 years into it now. In terms of impact, what we're seeing from the model is really encouraging. Over the past year, only 8% of individuals supported by the Asset Coach have required readmission to T-Canal. This suggests a reduction in repeat crisis presentation, and that's particularly important in crisis services where we often see people cycling back through for support. We're also seeing very strong outcomes in relation to housing. Of those identified as at risk, 100% have avoided a homelessness presentation, and the vast majority maintained or secured appropriate accommodation. And that, again, is particularly significant given the challenges within the wider housing system, including limited availability and increasing pressures on services. And many of these individuals were starting from a position of significant risk or instability. Alongside this, we're seeing improved discharge experiences, reduced reliance on crisis services, and stronger community connections. We see these outcomes as reflecting the impact of strengthened discharge planning, relational continuity, and a strength-based approach. So it's not just about crisis reduction, it's about building the longer-term stability. And importantly, it reinforces that when we do bridge the gap between crisis and recovery, people are much less likely to return to crisis in the same way. So our key learnings, in terms of what we learned from the work so far, is that relationships must extend beyond discharge, that flexibility supports sustained engagement, multi-agency relationships are critical to effective support, increasing social stresses beyond housing are impacting individuals, and holistic support is essential to preventing crisis. So what these key learnings really highlights for us is that the way we deliver support is just as important as the support itself, particularly when we're supporting people to maintain stability in their housing and to avoid repeat crises. So a key part of this has been the development of strong multi-agency relationships, both internally and with external partners. This work simply isn't possible in isolation. It relies on collaboration, shared understanding, and ongoing communication across services, particularly across housing, health, and wider support systems. What we've also learned is that building this shared understanding takes time. So there has been a real need for ongoing information sharing with external teams to ensure clarity around the role, what it offers, where its boundaries sit, and how it complements existing support. So at times that has been a challenge, particularly where expectations of the role haven't always aligned with its remit, and we've had to navigate and clarify those responsibilities. However, this has created a valuable opportunity to strengthen relationships, raise awareness of the model, and develop a clearer, more consistent understanding across services. And ultimately, this benefits the individual that we're supporting, reducing confusion, minimising duplication, and ensuring they experience more coordinated, consistent support at what is often a very critical point in their recovery and housing journey. So where those relationships are in place, we're able to respond more quickly, reduce any gaps, and create a more joined up experience. It also strengthens our ability to advocate, particularly where people are navigating complex systems like housing, health and welfare. What we're also seeing is an increase in wider social stresses beyond housing, particularly financial pressures, system barriers, relationship breakdown, and an increasing complexity of needs. And while these may sit outside of housing alone, they have a direct impact on people's ability to maintain safe and stable accommodation. Many of these challenges sit outside the individual's control, particularly within the housing systems, welfare processes, and the wider cost of living, which reinforces that support needs to be flexible, relational, and able to respond to complexity, not just immediate crisis, but the factors that contribute to housing instability over time. So while outcomes are positive, they've been achieved in a context where need is increasing, systems are under pressure, and people's lives are becoming more complex. But ultimately, what this shows is that continuity, flexibility, strong partnerships, and relational support are key not only to preventing repeat crisis, but to sustaining housing and longer term stability in an increasingly complex system. Thank you, everyone.
Thank you so much, Chloe, Jo, and Nicole, for sharing that presentation. Right, we are moving on now to Jake and Tess from MAC-UK for our final presentation.
You're on mute, Tess. Good start, yeah?
Hi everyone, my name's Tess and I'm presenting here with Jake. We work for MAC-UK. Jake, do you want to introduce yourself? I will, and then I'll kick us off.
Sure thing, yeah. Hello everyone. I'm Jake. I'm the Public Health and Prevention Lead at MAC-UK. We're a mental health charity working across London. Thank you very much to everyone speaking before and to everyone for being here.
And I'm Tess. I'm a clinical psychologist by background. I've been working at MAC for about 7 years. And a lot of my work has been within our partnership projects where we work in partnership with other organisations, thinking about how we can shift power to young people through co-production. And I also work in our internal youth employment team, where we employ young people with lived experience of some of the challenges that our organisation is trying to tackle. And they're focusing on their own solutions through social action projects and then being bridged in and thinking about their aspirations afterwards. But yeah, we're really excited to talk to you today and share very briefly our learning about developing a contextual mental health framework in the housing sector. So just to start, just to share a little bit about our organisation. So MAC-UK is a mental health charity, and we seek to radically transform the future for socially excluded young people. So to do this, we're wanting to work directly with young people and have a focus on building alternative solutions and services through multi-level systemic intervention that addresses both the impact and the root cause of social inequality. So for us, we see mental health as like very much contextual, and we recognise the impact of inequality and other wider social forces on the health and well-being of young people. Our team brings a huge range of professional experience across multiple sectors, so youth work, clinical educational psychology, public health and policy and research. But alongside our professional expertise, we really value and celebrate the knowledge and skills that our team's lived experience brings to our work. So over the last 10 years, a significant part of our work has been in partnership within statutory and grassroots organisations to share our own approach in a way that can be helpful. So to do this, we draw on our integrate model as a guide for our work. And the key principles of that integrate model are to work at all levels of the system. So we work with teams, individuals, organisations, policymakers, to be relational, as has been talked about in the other presentations. So really seeing trusted relationships is foundational to everything that we do, whether that's with young people, teams, systems, and really thinking constantly about how can we shift power to young people through co-production. And so we try to achieve that change by embedding ourselves in services. And this is going to share some of how we have done that within the housing sector. So we were working within the housing sector for about a particular organisation for about 2 to 3 years, and really thinking about how to develop an approach for co-production. So really getting to know the young people, the team, understanding the struggles and the day-to-day reality of the housing sector, and from that co-producing what a contextual mental health framework could look like.
Yeah, so essentially we would as Tess said, we kind of locate mental health at, and actually Chloe Joe kind of touched on it before. We locate mental health within the kind of wider social context in which it exists. And I think fundamentally working in kind of supported housing settings, and as everyone here will be aware, like in semi-independent or or kind of crisis housing, there are so many contextual factors that are impacting upon people's mental health. I think that is being exacerbated by the rising inequality that we experience. And the research shows that with kind of increased inequality, the kind of definition for like health and social problems also increases. And there was some research done from the University of Wisconsin a few years ago that kind of identified that the UK is behind the USA only, pretty much, in the in the kind of amount of inequality and the amount of kind of what they would define as health and social problems. So we're coming into working with the housing association that we worked with this in mind, understanding that people's and again, as Chloe Joe, really great presentation had said, is like people are coming to this with a lot of instability, a lot of experiences of social isolation, whether that's through kind of gender, race, sexuality, neurodiversity, experiences of poverty, and and so what we wanted to do, and our approach as MAC-UK is really to build relationships with the young people and the staff within the housing setting, and support them to kind of co-design what a mental health intervention might look like for them. We we do this ordinarily through a youth employment framework, as Tess had touched on, and support young people to be a part of how we work right from the jump. And that again is like was quite a challenging thing to do, coming into a housing association, coming into a supported accommodation environment, which is like a hostel, 25 bed hostel, and building relationships with those young people who kind of had initially already felt isolated within that living environment. And as Sarah had said, like coming and kind of being clear about what we are offering is a really like key part of like how we start the work that we wanted to do. But there was already kind of a sense of kind of being unsure of like what it was that we were doing. So we ended up setting up regular groups with young people. So it'd be working alongside a group of kind of 6 to 9 young people every week, building relationships with them, supporting them, understanding who they are, building trust, and thinking about what they would want to see in the project. And just to say, regarding this slide, young people that we work with kind of consistently and have, over the last 15 years, which is how long we've been around, we have, we understand that they have often like the clearest idea of like what they need. And so to kind of support their autonomy and support the kind of their sense of control and their sense of power over their future is a really, really fundamental part of how to improve their mental health. The instability, the kind of uncertainness of where they're going, and also the feeling of being kind of in the hands of services, and have services kind of dictate where they're meant to be at a certain time or what they're meant to do, or you know, how they spend their time is a really, really can be quite disconcerting and can kind of create an environment of, you know, like a kind of create a sense of like pathologizing themselves and their identity as like in need, when a lot of the time they are actually just kind of craving the kind of ownership over their future, and the support that comes with that, the kind of wraparound support that is needed to support them in that journey. Yeah, if you move on to the next slide.
So this kind of gives like a snapshot of what we did over the couple of years. I think this one kind of particularly focuses on the year and a half that we were embedded in the services, like building relationships with staff and young people. So as Jake said, we were kind of going every week, building relationships with young people and really starting from a place of their passions and interests and asking for their help on what would be supportive of their well-being. And I think that kind of allowed for power to be flipped on its head from the start, young people seeing it as being, you know, the experts of the challenges that they were facing. Over time, through relationships and conversations, young people asked for help to be bridged into resources that they needed, and then also shared ideas on what they thought would support themselves and others in the housing, their well-being. And that led to 2 co-produced projects. And I can share a little bit about the process of one, because I think it really speaks to some of the challenges and what would support young people's well-being. So we were building some relationships with a mother and baby service, and some of the young moms were saying, actually, you know, we have been experiencing a lot of isolation. We've been moved away from the boroughs in which we grew up. And their idea was to develop a play group, also because they had experienced a lot of judgment in some of the other play groups that they had been to. And so we went every single week, met with a couple of the young mums, and really, through every stage, thought about how to set up this play group. So we went out into the community, we went to visit community centres with some of the young mums to think about them as potential venues. We got a budget, which we then made a list and bought all of the toys that they wanted for the play group. We did a co-produced safety assessment together to think about any risks that might come from the play group. And I think it really, without working directly with some of the young mums, we wouldn't have seen a lot of what they noticed. For example, we went to a venue and they were quite quickly, which I thought was great, they were quite quickly like, no, this absolutely wouldn't be safe for some of our babies and toddlers. And so it was really kind of key for us to kind of develop something that would work. And I think throughout that process, we also saw what was in the local borough, in terms of different community centres that offered free activities that young people could access, and really started to kind of build relationships with those. Over this time as well, part of our approach is really to think about how we can develop something that's sustainable. And so we were doing thinking spaces with staff, which was around partnership working, co-production, and really kind of learning about some of the challenges that they were facing in terms of supporting young people, as well as starting to hear from young people in terms of the challenges they were facing as well.
So some of those sessions with the young mums, like they didn't know each other. Like they were living in the same building, right? And they had kids of roughly the same age. They had been through kind of similar experiences, but they actually didn't know each other, right? And I think what was really, and this was true as well for the other service, like the other project that we were in the same borough, which was for again young people, but who were like deemed as kind of like medium to high risk. They're all living in the same space, but their like sense of community and their sense of belonging to like that place was really, really fractured. So to be able to like facilitate a space where actually they just got to know each other, they became friends. Obviously, um, there are a lot of things that come with being able to like build relationships with people who are going through similar things to you at a similar time, to be able to support each other. And I think that's like one of the fundamental things that we learn, is that like actually the sense of community and the sense of belonging and identity and shared identity is really like fundamental to making people not feel so isolated. And I think like as was mentioned before, like isolation is a really, really dangerous thing in those kind of settings, and staff and young people alike were like actually saying a lot of the time, like, just the young people spend all their time in their rooms on their phones and not interacting with people around them. And there was a couple of like contributing factors to that, and I think the
next slide. Sorry,
yeah
Jake's coming on to that bit. Thank you.
yeah, true. And I think like the physical environment is part of that. And yeah, here we go. Like some of the challenges that came with these housing projects is like, yeah, the physical environment, it was set up in such a way, and actually like and combined with policies that and a culture that kind of meant there was a like a risk aversion to young people like interacting and kind of cooperating and building relationships with each other. Like there was almost like a sense of like, actually it's going to be harder to like work with young people if they are all getting together and they're all kind of sharing their experiences, and then they're all kind of asking for the same things that maybe there aren't the resources to provide. So I think there's like a really, really fundamental thing of like how you embrace that challenge of like, okay, well, actually, how do we flip the power like dichotomy on its head, as Tess had mentioned? Like, how do we support young people to come up with the kind of like rules and policies that they want to see in that space, right? So, there were a lot of policies and stuff that were consistently kind of pushed back against by young people, like in terms of like how many visitors they could have, in terms of being able to go into each other's rooms, in terms of doing stuff together, like, and that was recognized by the staff as well. Like a lot of times the staff would say there was like they were almost playing two roles. One is like they're there for the therapeutic, for the mental health support, to support young people to kind of overcome the challenges they face. But then they were also there to enforce the rules that were set by the housing, by just like standardized rules, like nothing really wild, but like they were there to like enforce those rules and like give warnings out, and also like, write notices to quit if young people did break those rules. A key thing is like substance abuse. So if a young person comes into the housing and was like, I really want to quit smoking weed, it's not serving me, but I smoke a lot of weed. The frontline worker would say, right, well, I'm here to support you through that. But at the same time, if you're found with weed, then you're going to get a warning, and that's going to impact you on your move on. And it's like, as was mentioned, I think by Sarah and by Chloe, it's like flexibility being really, really fundamental to how you work with people, and that being like could be like a real sticking point, just in terms of how your relationship develops with a young person, and then how you're best able to support them. Yeah, move on to the next slide.
Let's move.
I know we're running out of time.
We've got five minutes. So we kind of learned from all those challenges, speaking with staff and young people, and really starting to think about, okay, what would a contextual mental health framework look like? And really thinking about how that requires quite like an organizational approach. So this housing association had a co-production team who were really trying to do a lot actually, and working more within the operational part of the housing sector. So working with them and staff and young people to really think about what that would look like. And key to all of the recommendations that we made and in developing this infrastructure is autonomy with young people. As Jake really kind of spoke about, that without kind of focusing on that, services can repeating the same systemic trauma that young people have faced. And so this approach was really how to develop an infrastructure for co-production and relational safety. Staff are really trying their best and wanting to go out into the community and do co-produce projects as well, but we're really limited on time and capacity. So really thinking about how resources ring fence to kind of support that co-production. And as Jake was talking about, how to begin co-producing those environments with young people and seeing that actually that approach can be a supportive intervention in itself. It can be a healing intervention in itself. And really thinking about how that is kind of embedded into the whole culture of the organisation through the governance, through policies and processes, through resource, through time. So I'll pause there because I think, Jake, I don't know whether you want to speak to some of the other learning that came through this project, both for us as an organisation and the projects that we're kind of coming on to.
Yeah, absolutely. So yeah, if you move to the next slide, yeah, essentially what like what Tess was saying, it really would take an organizational shift, and there was a kind of commitment there, especially within the co-production team at the kind of head office, to try and embed these things. Sorry, I thought we had another one. We don't. To embed co-production. The other thing that we have learned, and I think the key thing that we have learned on this from this project specifically, but also through our kind of experience within housing over the years, and as it's been touched on, is that like autonomy is fundamental, and to like as much as there are always going to be power imbalances, but as much as possible to support young people to have power, to have autonomy over the decisions that are often made about them without their input, but like also not just like about like around the decisions made about them, but also what would it look like? How can we imagine an alternative future where young people actually have like ownership over their environment? So we really came away from this project thinking, actually, as I'm sure everyone here is aware, you know, tenders that go out from councils are often given to the provider that can offer the cheapest service and tick the most boxes. And a lot of the time in semi-independent and as like I say, as you all are probably really aware, like there is a gap in the kind of housing market that allows for people to offer emergency accommodation at a real premium for those young people that are like deemed as like the most high risk or that are in crisis, and that costs a lot of money, and a lot of that money isn't seen on the ground like in the services. And I think it's a really, really fundamental like question of like economics of like how can we shift that? Like how can we actually leverage assets, so like housing, property, and put it back in the hands of the communities that we're working with as frontline workers, right? So we have since this project developed like a cooperative housing model that identifies the ways in which young people could actually be members of a cooperative board and be part owners of the properties in which they live. So that would like require, you know, fairly a decent sized property. It could be a family home, could be bigger, and then also alongside that have like the wraparound support for the young people to identify, like to work on like how you manage a property, how you develop a service, and actually have them as equal partners in that process, and have them like actually invested in it in a way that is actually going to really, really benefit them. I will leave it there because I'm aware I'm probably well over time. So I'm sorry, but we've written a report based on, you know, identifying how a cooperative housing model could work with homeless young people and people who are experiencing like multiple kind of vulnerabilities. So please just reach out if you wanna read that.
Thank you so much, Jake and Tess, and for all of our presenters today. I think we've covered a huge amount in a relatively short space of time. Does anybody have any questions for any of our speakers on any aspect of the projects? I think we've got, and then I'm going to move into some general discussion questions for the panel. I think we've got a question in the question box. I think Tess and Jake, this is probably for you guys. It's from Julia. Could this be run out across the board, starting in schools, as it would be helpful for some of the major issues in our area? So I'm thinking that's probably speaking to some of the kind of the co-production principles that
Production stuff.
yeah.
Yeah, I mean, yeah, it's a challenge, honestly. Like, going into like established, you know, organizations and yeah, into services and schools that have got like a set way of doing things is a challenge, because you are looking at like trying to, you know, see how operationally things could be changed. So that actually like requires and as Sarah mentioned before, like it requires buy-in from not just like CEO, not just from like head teacher, but from all staff and from young people. Young people often is the easiest people to work with and build the relationships with. But actually, if there is a school that is willing, there is no reason why it couldn't work in a school. And I think it's almost like a kind of Montessori approach of doing things, is like how do you share the power? How do you support like young people to be in the lead of their own education? So I could see it working in schools to a point, but it would take, you know, it would take a change in like how people perceive risk. I think safeguarding is really, really fundamentally important. I think there are some like real flaws with like traditional safeguarding, and so to like take a kind of more like yeah, kind of what's the phrase I'm looking for, like a positive risk taking kind of approach. It needs to be looked at and think about like, okay, well, what are the kind of contextual factors that are causing harm, rather than just like this like rather than like individualizing issues of risk and safety, and kind of understanding like risk is there in society. And yeah, I think that would be the biggest change or the biggest challenge within a school setting. I work quite closely with a lot of schools, and it people are institutionalized and set in their ways of doing things, so it would be difficult, but it is definitely possible because we've done it.
Thanks, Jake. Mina, I think I can see in the chat that you've got your hand up. Did you have a question for the panel? Or was it an accidental hand up, which I'm prone to do? If you do, feel free to come off mute, or you can pop it in the pop your question in the chat. Any other questions for the panel before we move on? Okay, so we've got some questions just to kind of unpick some of the challenges that you're sort of seeing in your individual settings. So this is a bit of a broad question, and it might be yeah, kind of tricky to kind of pin down, but I wondered if you could each sort of speak to what you see as some of the sort of mental health issues or challenges that individuals that you're working with are kind of facing at the moment. Are there any kind of reoccurring themes that you're seeing? Sarah, I don't know if you're happy to kick off.
Hi, yeah, we're seeing people with undiagnosed neurodevelopmental issues, which gets in their way of them being able to access support and workers working with them maybe not understanding the needs of those individuals, seeing people with a lot of either complex PTSD or PTSD from incidents either within the home or outside, and again psychosis. So within the hostels, the staff are dealing with a lot of service users who have got significant mental health issues.
Thanks, Sarah. Chloe, Jo, Nicole?
Yeah, absolutely. I think, I touched upon it in our presentation, but what we're seeing is an increase in sort of social stressors that's contributing to a lot of people's mental health issues. And I feel like they're hitting a bit of a barrier that when they present to mental health professionals, if it doesn't tick the box of a professional diagnosis or they can't prescribe them with certain medication or treatment, then they sort of, they slip through the gaps then. They haven't got that support there, which is obviously what we're aiming to do. But yeah, we're definitely seeing an uptick on social stress as contributing to a lot of mental health issues nowadays.
Thanks, Chloe, Jo. Jake and Tess, anything from your perspective?
I mean, I think quite similar to what Chloe was saying, like a huge increase in social stresses, and just thinking about like the international and UK context at the moment and how that's impacting young people. So the rise in fascism, the rise in transphobia, both impacting people's well-being directly, but also then in terms of how they can access support, services not being structured to support. And in fact, people's experiences, of discrimination kind of being repeated. And so feeling very unsafe and that they can't seek support from people. I don't know if there's anything else you want to add, Jake.
Yeah, I mean, totally. Like people who are living in kind of precarious situations, and whether that's like with regard to housing, whether that's with regard to like asylum status, whether that's with regard to like gender identity, sexuality, race, like there is an increase in fear, and rightly so, because there's an increase in violence within the communities that we work, and it's those communities that are like at most risk of like experiencing homelessness and experiencing like severe deprivation, and that is a social issue. So it's not like, whilst like the people we work with, they have maybe mental health conditions, or they have different kind of like diagnoses. Actually, like if we zoom out and we look at it at a population level, we can identify like, oh, there is like a lack of resource for everyone. Like, that it's hard for me to get an appointment at my GP, let alone for someone who's seeking asylum, or someone who's got refugee status, who might have a substance misuse issue, to access like a kind of permanent accommodation and an environment that is going to support them out of whatever challenges they're facing. So yeah, I would say it's like a real like increase in kind of social stresses, exactly as Clojo mentioned.
Thanks, Jake. And I mean, you've sort of touched upon this already, but what do you feel are some of the gaps then in terms of mental health support for both the people that you're kind of working with, but also from kind of, again, what you're hearing from others across the sector at the moment?
I mean, for me, it's like community, it's access to like community resources, like it's access to like the ability to kind of share our lives with each other, and in a way that isn't pathologized, it isn't medicalized. Actually, the ability to have the time and the space and the capacity to be a part of a community in a very real sense. And that means like actually like owning part of the community. Like there are so few kind of shared spaces that that communities are actually invested in, and have access to like as their own, that aren't under threat. Like you see, but we work at Art Against Knives in Barnet, and we're basically the only place in the borough that is open for young people who are experiencing these multiple disadvantages, and it's like a second home for them. But like, you can't, Barnet is a big place and you can't access, not everyone can come to this one spot, like I think there needs to be a real investment in how you set up community spaces right across the country.
Thank you, Jake. Chloe, Jo, or Nicole, did you want to add anything into that?
No, I think it's exactly the same. We see it a lot in the crisis houses. Tynol, for example, covers the whole of Gwent, but there's several boroughs that fall within Gwent, and what's available in one borough won't be available in another. So we have to be very mindful when we're offering support or signposting or referrals for individuals that what we can offer to one, we may not be able to offer to another just because of where they live in. So it seems to be, an inconsistency across different areas.
Sarah, from your perspective?
I think from my perspective, it's the services are there, but it's having long waiting lists. Somebody might be waiting a very long time, or they might not meet service criteria, or the discharge and attendance policy might be extremely rigid. So, if somebody doesn't attend an appointment, doesn't inform the service that they're not able to attend, and does that a second time, they then get discharged. And these are people who maybe have struggled to read the letters, struggled to get to the service. So it just kind of huge gaps in service offerings.
Thanks, Sarah. Yes, yeah. I mean, it's not a great picture across the sector at the moment, and it's obviously what we're hearing through our frontline worker survey as well. Sarah, I just wondered, just thinking about the challenges in terms of the mental health gap and the impact on staff. I know that through your project, you've done quite a lot in terms of reflective practice, the training for frontline staff. Could you speak about some of the kind of the positive aspects that you found through providing that training and that sort of reflective space for staff?
Yeah, I mean, I think that has been the outcome that people hadn't expected from this project, in that one of the things that they were very, very suspicious of psychology, the staff were. They were very worried that we were going to come in and be the expert. And I was really keen not to do that, and just to go in and learn about how the services worked, get to know the staff, how they worked as teams, how they communicated, and helping to think a bit about what their gaps in knowledge were. So the training that we delivered really was driven from a questionnaire that we'd sent out to staff, and staff requesting what they felt that they needed. And what was nice about the training was, instead of, usually people get sent to a training where they might be there with lots of people from other organisations, we were delivering the training to staff teams. So they were able to talk about the service users that they were supporting while we were delivering the training. We're able to say, oh yeah, okay, so with respect to this is how we need to be working with that person. And then we could have a team conversation about it while the training was going on. And then in the reflective practice sessions, the staff have all got to know each other very well and recognise that they're bringing stuff into work, and that they are facing things at work which impacts them personally, and that if another member of staff is handling a situation in a different way to how they would, that may create splits within the team. So we've just sat and talked about it and had really honest conversations and covered very difficult subjects. But some of those sessions have been quite tense, and people have said, oh, that last session was quite tense. But they've all bought into it and have signed up to it, and are now finding actually reflective practice is something that they are finding very useful, and are concerned about not having it in the future when the project ends.
Thanks, Sarah. Chloe, Jo, I don't know if quickly you want to share any sort of positive reflections from staff on having the asset coaching model and kind of additional capacity.
Yeah, I think it's been really useful for staff. So with the crisis houses, there's a guided maximum of a 2-week stay. So I think it's that reassurance and knowing that we can start the work and someone that we know is going to finish it off. It's not going to be, okay, there's that glimmer of hope for this week or 2 weeks with us, and then chances are, you know, they'll leave, they'll be unsupported following they stay at the crisis house, and then things will be sort of, you know, will slip a little bit. They won't be able to navigate the systems, and then we'll see them coming back through the door in a few months' time. So I think it's just knowing that there is that ongoing support and they're being supported in the ways that they need to be supported. I think it's really reassuring for staff to know that.
Thanks, Chloe Jo. And Jake and Tess, just briefly for you and your experiences of working with staff in the housing projects, were there any kind of reflections on the benefits from a staff perspective?
Yeah, I mean, I think similar to what's already been said, you know, I think this project and our experience of partnership work, both with the staff in this project, but also our own team, has really like emphasized the need to kind of prioritize resource to support the capacity of the team and sustain people's like well-being, joy, creativity, like hope in this work, because everybody cares. That's why we're here. But I think what the impact of reduced funding and people not having a voice is it can just really, really impact morale. And so how can you build that into the day-to-day structures? Like have time to kind of move your body after a meeting, be able to kind of connect with other people, all of these things in the day-to-day, and how do we actually like build that into the structure of our organization as well?
Yeah,
Right.
I think like a lot of staff were really like grateful to have the space to think differently about how they approach their work and actually like be critical of what they were doing. Like I don't mean that in a negative way. I mean like to critically analyze that, okay, why am I doing what I'm doing? Why, like how can I like take my instinct, which is often right, and go with that and like have that nurtured and supported. And I think that was, yeah, one of the key things for me when I was talking with them.
Great, thank you. And just very briefly, in the last 2 minutes, I just want to, well, I want to first of all say a massive thank you to our panel and speakers today for very eloquently and, you know, engaging us in brilliant kind of overview of the projects and really drawing out and teasing out, you know, the challenges and, you know, some of the things that, you know, were unexpected, because I think sometimes we can kind of focus on the good, and actually there's so much learning in sort of exploring what hasn't worked or what needed to kind of move or shift through the project. So I just want to say a huge thank you to you all for being here today and for people for attending. Just finally, I just wondered if you could each share a very brief kind of one final reflection, key learning or insight that you want to share with our audience today. Sarah, are you happy to start?
Yeah, it's about having a small resource and seeing where the biggest gains are and the ripple effect. You know, implementing psychologically informed environments has just given staff the knowledge and the skills and the confidence to work with people with complex difficulties. Yeah, so small can have a big impact.
More could be big, absolutely. Yeah, Chloe Jo.
Yeah, I think for me, it's that, you know, relational support needs to extend beyond discharge from certain services. There needs to be more ongoing support to plug those gaps. And as I said, you know, the flexibility, meeting people where they are, and having that understanding that, you know, they're not going to engage in the same ways as they would if they were well or they didn't have all these stresses going on. You know, it's being mindful of that and adapting to meet them where they are and meet their needs makes a big difference.
Thank you, Chloe Jo. So yeah, really kind of teasing into that flexibility and relational way of working. And Tess and Jake, just very briefly and finally.
Mine would be co-produce with young people. Like they have the answers, they've got the solutions, and it's such a joy to build those with them.
Thanks, Tess. Anything to add, Jake?
Yeah, totally. No, couldn't agree more. I think co-production is fundamental. That's what I've learned, and yeah, and to experience kind of collective joy with everyone you're working with, because it you can achieve some beautiful things if you have fun.
Collective joy. I love that, Jake. What a way to end the session. Well, thank you so much to everybody. And I would encourage everyone to now go and get a drink and some, well, I was going to say fresh air. I don't know how fresh it will be, but get a bit of a screen break. And we look forward to joining you later this afternoon. But thank you so much, everybody. Take care.
Thanks all. Cheers.
Thanks,
Take care.
everyone. Bye.